Hello everybody. So here are the answers to today's quiz. So the first question is actually just a picture showing you a young female with a warty growth on the right cheek slowly enlarging since childhood. So clinically when you look at this, you think about probably an epidermal nevus, lymphangioma circumscriptum probably would cross your mind. So these probably are the two main clinical differentials you would think of. Now, what does the histology show? Histology actually shows epidermal papillomatosis, acanthosis, with hyperkeratosis, you can see here. But what is prominent is these very mature sebaceous glands placed quite high in the epidermis. So normally, sebaceous gland should open into a hair follicle. But you can see that these sebaceous glands are opening directly onto the surface. And this is a typical clue to nevus sebaceous. Often in the early stages, one may see a number of immature follicular units. You see hair follicle units like this without any sebaceous glands. So comedonal lesions are also common within it. But in the later stages, after puberty, after maturity, you often see this type of picture. So this is a typical picture of a nevus sebaceous. The clue is sebaceous glands opening directly onto the surface associated with some epidermal papillomatosis, some warty change. Now, how do you differentiate this from an epidermal nevus? An epidermal nevus typically, to be honest, actually all of these are part of the same spectrum. These are called organoid nevi. So epidermal nevi, sebaceous nevus, a Becker's nevus, for example, a comedonal nevus, all these probably come under the same spectrum. So these are organoid nevi, organoid perforation of normal skin units. So in epidermal nevus, typically there is no sebaceous perforation. You just see psoriasiform epidermal hyperplasia, acanthosis with hyperkeratosis. You don't see this sort of sebaceous perforation. You can have other appendigeal units, apocrine glands, acrine glands, also in higher numbers in both entities, to be honest. In a sebaceous nevus of Yadasin, or nevus sebaceous of Yadasin as some people call it, you see a predominant organoid proliferation of sebaceous units, and that's the only difference, to be honest. Both are part of the same spectrum. But having said that, because follicular units tend to proliferate more in sebaceous nevus, this is associated with other benign tumors. Now, previously it was thought that basal cell carcinoma was the commonest tumor to be associated with sebaceous nevus. So in a long-standing sebaceous nevus, sometimes if you have growths within, which are basiloid, people used to call them basal cell carcinomas, but now with the help of IHC and other techniques, we have now come to realize that all these are in fact benign trichoblastomas and trichoepitheliomas rather than basal cell carcinomas. So, coming to the next question, and this leads me on to the next question is, so the first question I put in is, if unchanging, the lesion can be left alone and monitored, i.e. excision is not necessary. Absolutely. So for most sebaceous nevi and epidermal nevi, malignancy is extremely rare, and monitoring is a very reasonable option. In most cases, they can be left alone unless for cosmetic reasons you want to excise them. So the answer is true here. The tumor most commonly associated with this entity includes syringocystadenoma papilliferum. The answer is true again. Now, I told you earlier that trichoblastoma is very common. If you look at different studies, trichoblastoma and syringocystadenoma papilliferum rank equally. So both these entities, trichoblastoma and syringocystadenoma papilliferum, rank equally, and both are commonly associated with sebaceous nevus, and both are believed to rise equally in equal frequency in this entity. Malignancy is extremely rare. Transformation to BC and SCC is extremely rare, and therefore excision is non-mandatory. Careful monitoring. Just tell the patient. In fact, I don't often see the patient back again. I just advise the patient, just keep monitoring the lesion. If you notice any unusual growths within it, please come back. We can excise it at any point. There is no harm in leaving it alone, unless for cosmetic reasons the patient wants to have the lesion excised. All right, thank you very much. I hope you enjoyed the quiz.